Hey, how's it going, everybody? My name is Dr. Ryan Smith. I am a lead faculty for the Clinical Management of the Fitness Athlete and Fitness Athlete Division for Institute of Clinical Excellence, or ICE. I'm also COO of Recharge down here in Ellicott City, Maryland. It's kind of in between the DC Baltimore area, where I coach CrossFit classes as well as treat patients out of here and have a little bit of specialization, I guess, in the pelvic health realm. So what I want to chat about today is postpartum fitness athletes and the postpartum women in your gym, and give some context to this first. Number one, if you're in any sort of fitness industry, if you're working in a gym, if you have a gym, if you're a PT working with clients who are postpartum, who have recently had a kid, you need to understand that there's a lot of questions that need to be asked when coming in through there, and that a lot of the women you work with postpartum have a lot of fitness goals and exercise goals, especially if they were very active beforehand and during their pregnancy and all that, and that there's a giant shift into how we're viewing stress on women during pregnancy and after pregnancy, and what exercise is good up to a certain point. And I just want to use today to allow you to be better than saying, just go as how you feel. Right? I think a lot of doctors either say, don't do anything, or say, just see how you feel. Right? You need to be specific with what we're trying to ask here and get really good questions first and foremost. If you're going to be a great PT and also working with fitness clients and athletes, I think it's very important for you to understand that the subjective part of working with someone who's postpartum and returning them to activity and fitness is the most important part. That starts with your questionnaires. That starts with your actual talking to them and their subjective experience, getting an idea of the whole process of how it went down, not only before they were pregnant, what happened during their pregnancy, what happened at pregnancy, and what happened after. All those stages of events are very important to what's going to dictate them going forward. Now, having a detailed questionnaire is a big deal, but what's the two key aspects I want to talk about today when we're working with this type of population that are important for you to understand with them? Number one is the idea of diastasis recti, or diastasis recti, however you want to say it. And this is very prominent for a multitude of reasons. One, because I think in the past there's been a very unhealthy viewpoint of it from the medical world. And two, it is very in front of you. It is right in your face for lots of women to see. Aesthetically, the diastasis recti is typically when there's a separation of the linea alba between the rectus abdominis there. Now, the biggest key point, and I hope you continue to reiterate this, continue with your clients, that a diastasis is absolutely necessary for pregnancy to occur and for birth to occur. If the abs were unable to separate, I can imagine how difficult giving birth would be, right? So you need to keep reinforcing this idea that this diastasis is a natural phenomenon, and that it happens to the vast majority of women throughout pregnancy. If it didn't happen, it wouldn't make it possible. I think that's lost because all women see is typically postpartum or after pregnancy is potentially this gap of their abdominal wall, and they get extremely scared about it and worried. And that's a very common thing, right? That I would be too if I had a separation of my abs the day after something traumatic happened, which, giving birth is like that. So reinforcing this is a natural thing. This is supposed to happen during pregnancy and postpartum. And that in general, what we're seeing from most of the research is that upwards of even 12 months, there's a decent percentage of women who still have some form of diastasis recti. Now, where that gets a little fuzzy in terms of the details is the exact width and to what extent and what this causes and everything. What I can probably say more confidently is that there's generally a lack of correlation between diastasis and back pain or hip pain, and a lack of correlation between diastasis and any sort of incontinence things, which we'll talk about in here in a little bit. So you can't say because of this that's causing those things. One, we don't know that. And two, we want to make sure that we're able to address these things in a very movement optimistic manner, right? This is a natural occurrence. This is kind of how it goes. Now, important questions to ask them along the diastasis route is, how do you feel with it? What does your abdominal wall feel like? Do you feel strong? What are you able to do before and after that doesn't feel quite right for you? Are you able to get back into the activity and feel comfortable within that, right? Being specific of, don't just say, go by feel, but ask them those more specific questions about how the separation is affecting them in terms of their strength and function. Because automatically a lot of women are going to jump to the aesthetic look of what that is. And rightfully so, I completely understand that. But if we can keep gearing them towards the function, do you feel strong? Do you feel comfortable in the activities you're doing with this? That's key. Now, generally, no exercise is off limits when it comes to working the abdominals or the core postpartum, right? Once they feel like they're comfortable enough, and typical for doctors at 6 weeks after giving birth, right? I usually say no exercise is off limits. Now, there's different levels of exercise that challenge the core, and they might not feel comfortable enough with the more challenging ones and might need to start off at a regress version, like any type of strength training program, and that's perfectly normal. We should be able to be experts in regressing the movement to make them feel better with that. Generally, what we don't want to see is this kind of pouching or doming right where that separation is. That's very significant, right? One, it's just not spreading the load appropriately, and it generally doesn't feel as comfortable to most women when I've asked them. Like when they do pouch or dome, one, they're like, well, I just don't like the look of it. But two, it doesn't feel quite right like it normally does. So that's one thing you're looking for and seeing. Can they spread the stress and the load over their obliques, entire abdominal wall, and the rest of their torso as they go through there? So those are big, important aspects along those. So be a movement optimist and talk about that diastasis is natural and absolutely necessary and lasts, a long time, usually past pregnancy, up to 12 months work I'm seeing. And that two, in general, in terms of function, returning to fitness, we want to make sure we're going away from this pooching, doming type thing right where the separation is, and we're able to spread the load. If they can only do the exercise and only dome and pooch, then we need to be like, let's regress this a little bit. Can you do it and spread the load better? If they can do it like that, then perfect. Now, there's a lot of other there's a lot of other strategies to do that, but that's kind of the general thing you're looking for, right? In addition to looking at it in terms of how much they can spread the load for them. So the second part of this has to do with urinary incontinence, right? If we wanted to reinforce and reiterate every time that diastasis was natural and necessary for pregnancy, for urinary incontinence, we want to say this is very common, but not normal, right? Commonality is far different than normalizing something, right? We want to say, okay, hey, I've worked with a lot of women. I know a lot of women who have had issues with incontinence after giving birth, after pregnancy, or even during, perhaps. And this isn't something that I necessarily want you to have going forward. I don't want you to normalize this. I don't want your incontinence to force you into a certain type of schedule or a certain type of activity going forward, right? And I'm amazed at the stories I hear of, like, the quotes of, I'll never actually run in the morning anymore because I only will run in the morning because if I do start leaking, I know that nobody will be out there to see me, or only run in the dark or stuff like that. When they start to change their life and their activity based on incontinence, we know they've normalized it, right? We need to say this is very common amongst a lot of women, and we don't want to say that it's a bad thing, right? It's common, but what can we do to work our way towards not making that your normal and making incontinence not part of your normal activity of your life? And so for a lot of women, that's understanding that there's this sort of pressure system and a regression and progression of strength training exercises for them, right? So if they can if they can jump up and down once and feel like they have control over their pelvic floor within that, right? And then they can jump up multiple times, but they get to like 15 jumps and they start to be like, ooh, I'm starting to feel like I'm losing it, but they haven't lost it completely. Well, they have a different type of threshold and they're managing their pressure system different than most of us would, right? So we need to be able to strategize and regress and progress these exercises of going through there. Maybe it's squatting that aggravates it. Maybe it's running. We have to be able to break down movement and regress it to allow them to handle the pressure and the stress and the load, be able to disperse it throughout their body, right? There's great strategies out there to do that, but we need to understand that. And it comes back to the idea of this is common, not normal. Let me help you move differently to alleviate this type of urge or stress incontinence type of feelings, so that way we can get towards a new normal for you, right? Be a movement optimist about it. Continue to be holding in that positive light. This is common, not normal. Here's what we're going to do to regress some of the stuff that's giving you issues and slowly build you back up. In essence, guys, after pregnancy and postpartum, if someone's looking to get back into activity, I view it so similarly to strength training, right? Of, hey, we just had a significant, what I call injury, right? And I'll use this analogy to them of all the things you see out there, moms going back to marathons the day after or stuff like that is great. But you have to understand it's a very small percentage. And sometimes it takes time. You need to give permission to yourself to use that time to heal appropriately. I'm not telling my 15-year-old athlete who just tore his ACL 3 days ago, all right, it's been about a week, let's go out and start running again, let's start cutting. That's an injury just like giving birth is. It's a traumatic incident to the body, not only from just what happens, but also your body was like this one day and now is very different the very next day. And we have to respect that and understand how much time and healing takes into this and give them permission, right? A lot of, I would say, postpartum women come to me and they hear so many different things from so many angles, social media, doctors, healthcare providers. I want to be that person and encourage you to be that person that views this in an optimistic light and gives them permission to really get a hold of how they feel, what their thresholds might be differently in terms of incontinence and diastasis and feeling along those lines, and give them specific ways to improve that. While meantime, they're also probably taking care of a child, if not more. And understanding the stress of that and taking care of all that and a family plays a role in how our ability to help them. We need to understand that. We need to speak in a way that is encouraging and optimistic and know that they are capable, extremely capable, but we need to help them find a way that we can, find these thresholds, talk about the commonality, talk about the natural currency, and find ways to get them back to where they want to go and discuss what their activity and movement goals are for them. A lot of them want to get moving, and a lot of them, when I talk to, are really excited to do so. There's a lot of fear and mongering amongst a lot of the stuff that goes on, and trying to be that person that can be a movement optimist for them is very helpful. And most importantly, really appreciating the subjective experience of it, asking lots of questions. I've had some training within the pelvic health realm, right? But I have learned a great deal by simply just listening to my moms and the women I work with more consistently, and just being like, how are you doing with this? How are you experiencing this? How can I relate to what's going on? And they've been amazing. I've learned from that. So go in with an open mind, ask lots of great questions, emphasize the subjective experience, talk about the natural occurrence of diastasis and that it's necessary for pregnancy and birth, and talk that incontinence, although very common amongst a lot of women, postpartum, does not need to be normalized. And we can do some really cool things to build you back up, to build up your pelvic floor and your abdominal wall in a similar way we would for strength training. And you're gonna be doing really well as you continue to learn how to take care of this whole new experience in life, and you'll be great. So go with that mindset. Those are your two key aspects. I hope you start working with more individuals who are postpartum, or if they're already in front of you, asking better questions and really being very upfront about, hey, I might not know everything, but I think I can help out a little bit. Talk to me a little bit here. So hope that's the Fitness Friday for you guys. I hope you learned a few things from it. It's a lot of messages that we emphasize here at Recharge within the ICE community. This weekend, I'm going to be out in Pittsburgh at Vishnu King's place, Matthew King's PT place. There's looking like 30 to 40 PTs there for Justin Dunaway's Total Spine Thrust Manipulation course. I am so jazzercised for that. I can't wait to get a little better at my own manual therapy skills along those. I also know that the Advanced Concept course for Fitness Athlete just started. Our foundational course for June 25th sold out. We start on Monday, so I'm looking forward and jacked to that. And I know the next cohorts for that are lining up. If you didn't see it, Sarah Horan just came out the course with us at ICE and joined the team of how to go out of network. It's an 8-week course, something I wish I would have been able to take when I first started up my own private practice right out of school. So I can't imagine the absolute guidance she has. She absolutely has a spectacular skill set at what she does. And I'm really looking forward to the product that she's putting out and being able to deliver that to students, to new grads, to anybody looking to understand how do I get out of network and use this in a way that allows me to build up my business when sometimes the in-network route just doesn't seem to be working it quite right for the business. So hope you guys have a great rest of the weekend. We'll catch you later. I'm off to Philly, then Pittsburgh. So stoked to see Justin this weekend and everybody else out there. So if you're out there, give me a shout out. Can't wait to see you. Bye.